One of the side effects of treatment was that my ovaries were damaged and they've stopped working. So as well as affecting my fertility, I've actually had to go through the menopause, which at 29 was a bit young. I was going through it at the same time as my mother. And that also has consequences. You know, it affects your mood, and you might be feeling depressed from treatment anyway, and all of a sudden you have these strange hormones that are going on. I'd be walking along on a cold day and all of a sudden I'd get a hot flush, and yeah, so that's something that happened about a year after I went through treatment. I dealt with menopause by just going back on hormones, so I'm on the pill again, just to try and help me with the side effects, which is fine. Just a little bit of hormone goes a long way.
The average age for women going into menopause is 51. For women who have a gynecological cancer, much of the treatment will involve removal of their ovaries. So in ovarian cancer, in cancer of the endometrial uterus, part of that treatment again is that the ovaries will be surgically removed. In women with cervical cancer, we will leave the ovaries in place unless they have radiotherapy, in which case that will affect the ovaries and they will no longer work. There are a significant number of women, therefore, who will go into menopause much earlier than they normally would, perhaps even as early as their 20s. The role of hormone replacement is very dependent on the gynecological cancer. So in women with cervical cancer, there is no reason why they cannot have HRT or estrogen because they have not got a hormonally sensitive cancer. With women with endometrial cancer and to a degree ovarian cancer, there are some associations with hormones with those cancers. So going on to hormone replacement therapy is a decision that really cannot be taken lightly and needs to be discussed with a specialist to find out if it's appropriate for them. We would not rule it out for these women, but it has to be as an informed decision with them and really taken into light what their symptoms are. We would tend to try other things first, and hormone replacement therapy would be a last resort. It's different when we're talking about estrogen creams that are applied in the vagina because they work on the local symptoms of menopause for women with gynecological cancers. The absorption into the bloodstream of those creams is very low, so they can generally be used for women with all types of cancers, whether they're hormonally sensitive or not, and can impact on quite a lot of menopausal symptoms, not just sexual symptoms, but also bladder irritation as well. What these women need to be aware of is the management of the long-term health issues that are associated with menopause. Although there are often simple strategies and non-hormonal drugs that we can use for we term the acute symptoms like hot flushes, it's the longer-term problems like osteoporosis, so thinning of the bones, and heart disease that they need to be aware of. So it's important that women who are in a premature menopause make sure, for example, that they are doing things to reduce their risk of osteoporosis. So that's having significant amounts of calcium in their diet, and we're looking at 1,200 milligrams. And to get an idea of that, so some women may find they need to take a supplement, there's about 250 milligrams in a glass of milk or a yogurt. They also need to get sufficient vitamin D, and that means being exposed to sunlight for 15 to 30 minutes, about 4 to 6 times per week. Weight-bearing exercise of around about half an hour, 2 to 3 times a week is really important. By weight-bearing exercise, we mean things like dancing or playing tennis or even just walking. All these things will actually help in their cardiovascular health as well and maintaining a healthy heart. They must stop smoking if they're smoking at the moment.
Premature menopause is a significant problem for many of our women who came to the diagnosis with ovaries that were functioning at least partially, if not completely, and who go to the operating theatre and have their ovaries removed and who are instantly menopausal. And this is anecdotal, but I think that those women have a really rough ride through menopause in terms of symptoms than others who go through it as nature intended, where their ovaries gradually shut off and slow down their estrogen production and finally stop. So the implications for that are all of the things that we know are symptoms of menopause, so vaginal dryness, mood swings, night sweats, probably the most frequently reported and disabling condition for women, skin itch, poor libido, and so on. What women most often will want to know is about the other ways that they can deal with their premature menopause. From the really practical things about how to manage premature menopause while you're at work, wearing layers of clothing that you can sort of strip off and put back on again and still remain decent in the office. Things like not having coffee and too much coffee and alcohol and spicy foods.